which will be coming. Call them what you will. Rationing is part of it. And
I agree. Huge. It's going to be a huge issue, and that's something else about which the president was not fully forthcoming and straightforward.
All right, so you believe that there will be rationing, aka death panels?
It's built into the plan. It's not like a guess or like a judgment. That's going to be part of how costs are controlled.
All right, folks. The interview that made news and is still resonating. That was Mark Halperin on this show a week ago, talking about death panels. I was talking about death panels, and he agreed with me. And I don't need to go through the logistics of how that all came about again. And joining us now to talk about it is Michael Cannon, Director of Health Policy Studies. And we welcome you, sir. Good to talk to you.
Happy to be here.
Well, thank you. Of course, at the Cato Institute, I should say. Of course, and I think I saw you were on with Megyn Kelly, I think, last week, and a couple of other people as well, talking about this very issue. I mean, it was fascinating to hear Mark Halperin, admit it and then try to backtrack. But, some people have known about this. You have, almost since the inception of Obamacare.
Well, that's right. In fact, before the law was even passed, that's when Sarah Palin uttered or put on Facebook her infamous phrase, death panels. Now, I want to be clear. I don't have the same position as she does on these sorts of panels. At least I don't think. I mean, what she was talking about, and she was quite right, that the president had at that point proposed a panel that would be able to deny care to people. It wasn't called the Independent Payment Advisory Board at that point, but it would be able to say no to certain treatments, and Sarah Palin was worried that this panel would do what the National Institutes for Clinical Excellence in Britain's National Health Service does, which is set an arbitrary line that says we'll pay for stuff that costs less than this, we will not pay for stuff that costs more than this. And she mentioned her elderly parents, her disabled child, both of whom would be eligible for Medicare, and she was worried about having government bureaucrats deny care to her family members. You could call that a death panel if you're one of the people who's being denied care. But if what the government is doing with scarce tax dollars is trying to decide how to buy the most health with those tax dollars, and trying to cut out the inefficient stuff, well, if you're trying to buy the most health per dollar spent, you could just as well, from society's perspective anyway, call that a life panel. I think that the problem here is that because it's going to lead to such, in part because it's going to lead to such
rationing.
Well, not rationing. Rationing is inevitable, but nasty disputes in the public square over whether coverage should be denied for this or for that, that this is not something the government should be doing at all. If the government's going to be subsidizing health care for people, it should be doing it the way it subsidizes seniors with Social Security. Give them a check, trust them to spend the money. Give seniors a bigger check if they're sick or if they have low income so they can afford a basic package of benefits, but then let them decide how to spend it. Don't let the government get into the business of deciding who gets what treatment and who doesn't, because there's no right answer to that question. The answers are going to depend on individual values.
But there are right answers morally to those questions if you go by how our society is operated up until this point. If you go by the Judeo-Christian values that we have, or the Judeo-Christian ethic that we have and have lived under to this point, there are right answers. In other words, if an 80-year-old man needs a bypass, he gets a bypass. You don't start saying, well, how much is it going to cost and how productive is he going to be to society afterward? And the alternatives to giving him the bypass is a death sentence. I don't know how quick a death sentence, but I've been told by Tom Daschle, and others have said this, give him a pill or put him in a hospice. I think that's a revolutionary difference that we're nowhere near ready to undertake, and it would be cataclysmic in my view.
Well, the problem is with what you just said there is that there's no objective definition of need. The only way to define need in these scenarios is whether the expected benefit of a treatment exceeds the expected cost.
What's benefit, though, Michael? You mean benefit to society or benefit to the patient?
Total benefit.
No. So that includes benefit to society. Is that what you're saying?
But here's what ends up happening in Medicare because everyone is spending someone else's money. And because medicine is so uncertain and outcomes are so probabilistic and uncertain. People in Medicare end up receiving all sorts of treatments that don't do them any good, that just end up torturing them at the end of life, that they would not sign up for if we just gave them the cash and said, you decide how to spend it, because it would not be worth it to them. They would be making the decision, no, this is wasteful care. I'm not going to spend money on this. I'm going to give it to my grandkids so that we can go on a cruise or they can have a college education or what have you. And that's the problem with Medicare today. The best estimates suggest that 1/3 of Medicare spending, and Medicare spends close to $500 billion per year, 1/3 of what Medicare spends does absolutely nothing to make patients healthier or happier. So the problem here is not that healthcare is being rationed. The problem with IPAB, which is the so-called death panel in Obamacare, is that it is a super legislature that is going to be able to make laws regarding rationing and taxes and other things that it's going to be very hard for Congress to block. So IPAB, this board of unelected bureaucrats, and sometimes just one bureaucrat, will be able to write laws that Congress itself would not have passed and would like to block, but cannot because of these very high hurdles and contorted procedures that Obamacare places or uses to protect IPAB and its edict.
We're talking to Michael Cannon, Director of Health Policy Studies at the Cato Institute, here on the Steve Malzberg Show. And, of course, those panel members are now able to be appointed by Obama, get through the Senate with just 51 votes instead of the 60 that it would have taken. And you and I agree. Let's listen to Robert Reich. We have that second cut there. Let's listen to Robert Reich, something he said several years ago. If he were the president and the president wanted to be honest with the people, here's what he would say.
Particularly you young people, particularly you young healthy people, you're going to have to pay more. Thank you. And by the way, we are going to have to, if you're very old, we're not going to give you all that technology and all those drugs for the last couple of years of your life to keep you maybe going for another couple of months. It's too expensive, so we're going to let you die. Also, I'm going to use the bargaining leverage of the federal government in terms of Medicare, Medicaid. We already have a lot of bargain leverage to force drug companies and insurance companies and medical suppliers to reduce their costs. But that means less innovation, and that means less new products and less new drugs on the market, which means you are probably not going to live that much longer than your parents. Okay.
Do you disagree with any of what he said?
Well, I disagree with the fundamental premise, which is that the government should be making any of these decisions. You see,
well, he doesn't say they should. He said if Obama was honest, this is what he would tell the people. That this is going to happen. That this is going to happen. Yeah.
I completely agree because, but look, you know, this the one thing that the one misunderstanding I would hate for your listeners to walk away with is this idea that we can somehow avoid rationing. Robert Reich says that if the president were honest, he would be saying these things. A lot of Republicans would say, no, we can't possibly have rationing in health care. But unless Medicare rations care to seniors, in other words, limits consumption of health care by seniors, you haven't eliminated rationing by getting rid of it in Medicare. You've just said that low-income families are going to have to ration their consumption of housing and food and clothing and education in order to pay the higher taxes that are necessary to fund this completely unrationed Medicare program with all this wasteful care that doesn't make seniors any better off and just treats them like pincushions in the last few months
Michael,
of their life. You
keep saying that, and it's not only the last few months of their life. How does anybody know it's the last few months of somebody's life until they die and you could look back and say it's the last few months of somebody's life? I mean, you and I agree the government shouldn't be involved in this, but nonetheless, to an extent, we maybe don't agree on the extent. But I'm sorry. Our value system right now is that we do anything we can to keep our parents and grandparents alive. And you said that, you know, if you change it and give the seniors a check, like here's 25 grand. You know, you have the bypass or take a cruise, that most people would take the cruise. I mean, I don't see that at all. So they'll say, oh, I've lived enough. Let me go out with a bang. I mean, you know, maybe the odd person would decide that. But most people want to live. And when it comes to a bypass or a hip replacement so they could move, my dad opted for back surgery in his 80s. It was risky. He came through it, thank God, and lived for 6 more years. But it was such pain, he needed the surgery. I mean, all this would be denied. My mom had non-Hodgkin's lymphoma 2 years ago. She's now 86. She had a 10% chance of survival. She beat the odds. She would have been denied. My father would have been denied. That's not the kind of way we were brought up in this country. We try to keep our parents alive and comfortable. And what about disabled kids? What about disabled kids at birth? How much are they going to cost us? Do we start measuring that?
We are in agreement that the government has no business making any of these decisions. And my only point about the reflexive conservatives' objection to government rationing is that you are not abolishing rationing. For every 80, 90-year-old, 100-year-old who gets a hip replacement, you are taxing people and forcing them to ration their consumption of other necessities of life and limiting their upward mobility, limiting their ability to provide health care for themselves. And so you're not abolishing rationing. And in the process, because, and here's somewhere where we agree, because the government is controlling the money and because everyone in the Medicare program is spending someone else's money, Medicare ends up paying for a lot of stuff that does not make seniors healthier or happier, and that seniors would turn down if it were up to them. If you look at polls of senior citizens, you ask them where do they want to die. In fact, ask any member of your family
at home.
Above 80.
At home.
They will say, you ask them, you want to die in an ICU or do you want to die at home? They will say at home. And
but if you ask them if they want the bypass or not, which will help keep them alive, they'll say yes. And now they're going to be told no.
If they're in their 80s, probably. If they're in their 90s, less likely. If they're over 100 years old, the point is that at some point, the costs of these procedures outweigh the benefits.
Well, no, outweigh the benefits to society, not to the individual. Oh, come on.
At some point, the senior citizens will say, you know what? I don't want to go through this anymore. And it is the most wrenching decision.
All right, but that's not because of costs. That's because of emotions and physical weariness.
And sometimes they go through these things not because they want to, but because they want to be strong for the people around them.
All right, listen, this will be continued. I really appreciate you coming on, Michael. Thank you very much. I hope you'll come back.
Hope so.
Take care. Michael Cannon, ladies and gentlemen, Director of Health Policy Studies at the Cato Institute. When we come back, these women, it's a crazy thing, okay? This woman who's for dieting and having women be thin, she's accused of hate speech by a woman who likes big-bodied women.